NSAIDs, or nonsteroidal anti-inflammatory drugs, are a class of medications that are used to relieve pain, reduce inflammation, and bring down a high temperature. They are widely used to treat a variety of conditions, including arthritis, headaches, muscle aches, and menstrual cramps. NSAIDs work by blocking the production of certain body chemicals that cause inflammation. This helps to reduce pain and swelling. NSAIDs can also help to thin the blood, which can help to prevent blood clots. There are many different types of NSAIDs available, both over-the-counter and prescription. Some of the most common NSAIDs include aspirin, ibuprofen, naproxen, diclofenac, celecoxib, meloxicam. NSAIDs are generally safe for most people to use, but they can have some side effects such as stomach upset, heartburn, nausea, vomiting, diarrhea, headache, rash, increased risk of bleeding. In rare cases, NSAIDs can also cause more serious side effects such as liver damage, kidney damage, heart attack, stroke. If you are considering taking an NSAID, it is important to talk to your doctor about the risks and benefits. Your doctor can help you to choose the right NSAID for you and to monitor for any side effects. Here are some additional information about NSAIDs. NSAIDs are available in a variety of forms, including tablets, capsules, liquids, and creams. NSAIDs can be taken on an as-needed basis or on a regular schedule. The dosage of NSAIDs will vary depending on the type of NSAID, the condition being treated, and the patient's individual needs. NSAIDs should not be taken by people who are allergic to them or who have certain medical conditions, such as ulcers or heart disease. If you are taking an NSAID, it is important to be aware of the potential side effects and to talk to your doctor if you experience any problems. Here are some of the benefits of NSAIDs. Relieve pain. NSAIDs are very effective at relieving pain. They work by blocking the production of certain body chemicals that cause inflammation. This helps to reduce pain and swelling. Reduce inflammation. NSAIDs can also help to reduce inflammation. This is beneficial for conditions such as arthritis, where inflammation can cause pain, stiffness, and swelling. Bring down a high temperature. NSAIDs can also help to bring down a high temperature. This is because they help to reduce inflammation, which can cause the body to produce heat. Prevent blood clots. NSAIDs can also help to prevent blood clots. This is because they help to thin the blood. NSAIDs can have some side effects, some of which are more common than others. Here are some of the most common side effects of NSAIDs. Stomach upset. This is the most common side effect of NSAIDs. It can include heartburn, nausea, vomiting, and diarrhea. Headache. This is another common side effect of NSAIDs. Rash. A rash can occur in some people who take NSAIDs. Increased risk of bleeding. NSAIDs can increase the risk of bleeding, especially if they are taken with other medications that also increase the risk of bleeding. Liver damage. In rare cases, NSAIDs can cause liver damage. Kidney damage. In rare cases, NSAIDs can cause kidney damage. Heart attack. In rare cases, NSAIDs can increase the risk of heart attack. Stroke. In rare cases, NSAIDs can increase the risk of stroke. If you experience any of these side effects while taking an NSAID, it is important to stop taking the medication and talk to your doctor. Here are some tips to reduce the risk of side effects from NSAIDs. Take the lowest effective dose for the shortest possible time. Take NSAIDs with food or milk to reduce stomach upset. Avoid taking NSAIDs if you have a history of stomach ulcers or bleeding. Talk to your doctor about other medications that you are taking, as some medications can interact with NSAIDs and increase the risk of side effects. If you are considering taking an NSAID, it is important to talk to your doctor about the risks and benefits. Your doctor can help you to choose the right NSAID for you and to monitor for any side effects.